And you really get more new patients, higher treatment plan acceptance, and so much more by using these. Yes, you can. What are they? They're two things you have with you right now. I guarantee it. I promise you do. Hey, I'm Dr. Richard Madow, co-founder of the Madow Center for Dental Practice Success. Thanks for being here on this episode of the Dental Practice Fixers podcast. Of course, we've got some mystery shopper calls to dental offices today, along with lots of other good stuff. Lots of other good stuff. I like the sound of that. We've got lots of other good stuff. Hey, just a couple quick notices for you. Coming up in October 2025, I know it's a long way off, but we're going to be announcing it soon and it might sell out. And I really want you to be there. I'm going to be doing a seminar in the Cincinnati, Ohio area with Dr. Eric Block, the stress-free dentist. And it's going to be all about clinical and management tips to help keep your practice not just more productive, but also stress free. So, as they say, watch this space for it. Speaking of watching this space, I'm going to be speaking in spring of 2025 in Boston, Louisville, Phoenix, Charlotte, North Carolina, Detroit. I don't know. We do so many shows on the road, probably more than that I can't remember. But I know chances are you might be somewhere in the US or Canada or in this big wide world where I'm not coming to your town. So if I'm not coming to your town anytime soon, I want to also make you aware of something really cool coming up. And that is, I just recorded an at-home version of my most popular talk, How to Create a Memorable Patient Experience in Your Practice. And that's going to be available, as they say, it's going to be dropping really soon. So keep your eye out for that. And if you want to be the first to know about these seminars and at-home products, I'm getting lots of free, great info and tips for your dental practice and notifications about our free webinars, more and more and more. Just sign up for our newsletter at madow.com/tips. Just go to madow.com/tips, TIPS, and I'll come in your inbox every now and then and give you some great practice building advice. You'll also be able to keep up with all these other cool things going on so you can be the first and get them before it's too late. So I hope to see you there, and I'll drop by your inbox every now and then to say hello. You also find out when these podcasts drop, so even more reasons to do that. Okay, let's talk about two things you have with you right now, I promise, that will get you more new patients, higher treatment plan acceptance, and even lots more great stuff, higher revenues, et cetera, et cetera. Yes, I'm talking about your ears, not ears of corn, those two ears that are on your head. But it involves really paying attention to your listening skills. And this is something I've been guilty of it so many times that we always think we know what a patient wants. We always think we know the answer. And granted, many times we do. But that can also cause us to jump to a conclusion, to interrupt, to jump in before the patient's finished talking, and maybe even worse, to not truly listen. When somebody is talking to you, I don't care if it's a patient, a team member, a family member, a friend, anyone, that's the time to stop thinking about what you're going to say next, your retort, your comeback, your change of topic, your opinion, your 2 cents, whatever you want to call it. Now, of course, we're specifically talking about patients now, but this applies to anyone in your life. When someone's talking to you, let them talk, even if they're rambling. Don't interrupt, but most importantly, really, really, really listen. Now, I know some of these patients, especially the nervous ones, can be real ramblers. They can be real ramblers or gremlins or matadors. But when they're talking, if you're not thinking about what you're going to say next, or you don't interrupt, you really have the opportunity to learn about them, about their needs, their fears, their desires, what they want. We might know what they need, but you need to know what they want. And the things that they share with you can ultimately shape their success as a patient in your practice. So, yes, I'm rambling now, but what I'm trying to tell you, I hope you listen, is to listen. When somebody speaks, listen for hints, listen for clues. Open your mind. Don't think about what you're going to say next. Here's some examples. Let's say you're at the front desk. A potential new patient calls. They're not a new patient yet. And they're just going blah, 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 blah. You know what it's like. And we're busy up there. And you just want to hold the phone up and make goo eyes or cut them off as soon as you can. And yes, we do want to get them on the schedule. But resist that temptation and really listen. Listen for clues. Is it an emergency or a routine appointment? Are you going to schedule them the hygienist or the doctor? They might express some concerns about payment. That's hint. That's what our mystery shopper calls are about today. Or if you really, really listen closely, you can even add more new patients. What do I mean add more new patients? Well, let's just say I'm at the front desk at my office here in Baltimore, and I got someone on the phone, and she just moved to town, and she's going blah 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 blah. And I think I'm about to offer her an appointment, but she says something like, "Oh," I say, "Oh, she tells me she's new in town." Instead of just assuming things, I'll create part of the conversation. I'll ask open-ended questions and say, "Oh, welcome to Baltimore. What brings you here?" And she'll say, "Oh, my husband's on staff at Hopkins Hospital. That's why we moved here." So you could say, "Great," or you could say, "Congratulations, that's fantastic. We see lots of patients who are on staff at Hopkins. We know your insurance inside and out. It's great. Does your husband need an appointment too?" Now, boom, you just added a new patient because you listened, you saw that a couple moved into town, and patients that have that insurance you can offer. It's awesome. And then the person's go blah, 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 more chat, chat, chit, chat, chit, chat, chit, chat. Oh, by the way, I can't come in on Wednesdays or Fridays because that's when I drive carpool. Oh, what kind of carpool do you drive? Oh, well, we've got two kids at Wellwood Elementary School. Now's your chance to add two more new patients. Oh, that's so great. It's a fantastic school. That's just 6 blocks or so from our office. We see a lot of the kids and their parents. We love seeing kids here. Let's get your two little ones on the schedule as well. So, boom, just by listening, you've added 4 patients to your schedule instead of one. Now, this is just a tiny example of what can happen if you listen. Let's say you're in the back, so to speak. I hate that term. Let's say you're in the clinical part of the office. Um, Ask open-ended questions to your patients. Some people say that when a patient comes in, you should always say, "Are you happy with your smile?" But I don't like that question because nobody's 100% happy, but if they're mostly happy, or if they don't want to seem too picky or whatever, a lot of people just say, "Yeah, my smile's fine." When meanwhile, there might be something little that they want to improve. So when you ask a yes or no question, if the patient answers one way, you're kind of screwed because there's nowhere to go from there. If you say, "Are you happy with with your smile?" and they say yes, well, you've got nowhere to go. But if you say something more open-ended, like, "If you could change one thing about your smile, what would it be?" Then you're giving them the liberty, the opportunity, the flexibility, whatever you want to say, "Well, my smile's pretty good, but yeah, my teeth are a little bit yellow," or "My smile's pretty good, but yeah, this one at the front, it's got that tiny little overlap or that little space. That does bother me from time to time." You're giving them permission to tell you something, no matter how minute or trivial they think it is. You're giving them permission by saying, "If you could change one thing." So I love open-ended questions. And then when the patient responds, listen, listen, listen. Here's another question that I love, and that is, "Tell me about your past dental experiences." Because if you say something like, "Are you comfortable at the dentist?" Most people say yes, they're embarrassed. If you say, "Tell me about your past dental experiences," and again, not to throw their previous dentist under the bus, don't do that. But this can get the ball rolling to a real conversation and give you ideas on how to treat this patient better to make them the most fantastic, ideal avatar patient in your practice. So again, I love open-ended questions. I love listening. Listen with 2 ears. Resist the temptation to interrupt, or resist the temptation to show the patient that you're right and they're wrong. This is another topic altogether, but I kind of learned this the hard way. But let's say, for example, here's an extreme example, but a patient comes in and they say, "Oh, yeah, my grandpappy had 3 sets of teeth. He had one, his baby teeth. Then he had his regular teeth, and they all fell out. Then brand new teeth just grew right back in. Never heard of anything like that before." Now, look, we know that didn't happen unless the brand new teeth were dentures. But resist the temptation to say, "Sir, I'm sorry, that's physiologically impossible. Your grandfather did not have 3 sets of teeth. I think you got some misinformation." Why do that? Just, give a chuckle, say, "Hey, that's one for the books," or whatever, and then just move on. Unless the patient is wrong about something that's ultimately going to affect their clinical treatment and outcome. And even so, please be very gentle. Never tell someone they're wrong. It's better to say something like, "Well, this is how I see it," or "This is how we treat that in our office." Don't call someone out for being wrong. Listen, be compassionate, let the patient talk. So here's my final kind of statement on that, and that is, um, if you listen and you're simultaneously planning your response, waiting for the moment to cut in because you already know what the patient needs, or you think you already know what they need, you're going to miss out on a lot. So clear your mind, really take in what the patient is saying objectively and without judgment. Even if what they're saying seems irrelevant or silly, their words can really reveal their fears, their desires, their goals, what they want from you as a dentist and dental team. So by truly listening, you'll be the best dentist or team member you can be for that particular person. You'll increase your chance of presenting and completing treatment successfully, having another great patient in your practice who refers, stays, pays, says yes to treatment, all those great things we want them to do. It really, really starts with listening. Sometimes I think when I want to interrupt and someone's talking to me, I just think, am I being a brick or a sponge? When you throw something at a brick, it bounces right back. Nothing happens. A sponge takes everything in, and then when ready, responds appropriately. So when someone's talking, you have the choice to be a brick or a sponge. Be the sponge. A brick is sinking slowly. Be the sponge. Speaking of listening, for like the past 150 podcasts, I've been telling you that we save money every month at the Madow Center because we use Stacks for our credit card processing. They don't charge us a percentage, just a low monthly fee. Check them out at madow.com/save, madow.com/SAVE. Okay, let's go on to our mystery shopper calls. For some reason, I had financial arrangements on the brain today, so I did some mystery shopper calls. I called an office where I was not a patient, told them I needed a bunch of treatment, and I just want to know about the financial options. Now, if somebody's calling your practice telling you they need a bunch of treatment and they want to know your financial options, you better do a good job of letting them know they called the right place. You've got great financial options. Get them in for the exam so you can talk about the treatment and the financial options. It should be a no-brainer. I'm sure our practices did great. Let's go over here to Command Central and we'll do call number one, or as they say in Spanish, numero uno.
This call will be recorded for quality assurance.
Thank you for calling Family Dentistry. This is Denise.
Hey, I have a question for you, Denise. I'm pretty sure I need a lot of dental work, like 4 crowns, I think I've been told. What are the different financial options you have in your office?
We have Clear here that we offer to our patients. It does give you a % off your fillings or dental work that you have, like 20% off. There's a monthly service fee for it. It just depends on if you have, have you been here before so we know?
No, I've not. I've never been there before.
It just depends on the health of your gum tissue and all that. So there's, different pricings for that. So that makes a difference. And then we also offer care credit as well. So I don't know if you're familiar with any of those, but we do have those if you don't have dental insurance. But yeah, we do have a couple different options that we provide for our patients. But we are scheduling out right now till June. So that's just for cleaning. If you have things that you need to have done sooner, emergency-wise, we can definitely get you in sooner to see the dentist. But and then we do have a call list that we get people in sooner as well. So
what is Clear? I'm not familiar with that. Is that like a credit card?
Well, it is, yes. It's Clear Credit. You pay a monthly payment, and then you get a percentage off your services as well here. And we have a pamphlet here if you come in, and we can hand it to you, give it to you. You can look it up. Clear is Kleer. It's probably even online services that you can look up to see. But anyway.
Okay.
So, okay.
All right. I see. Thank you so much.
Yeah, you bet. Have a good day. Bye-bye.
Oh, you too. You bet. Have a good day. She certainly was nice. I am not a fan at all of the way she handled that call. First of all, right away she said, we have Clear. Now, People have no idea what that means. It's a dental membership program. I love smile clubs, dental membership programs, whatever you want to call them. But she just said we have clear. Made no sense to somebody. Patients don't know what the heck that is unless they come into your office and learn about it. And then she didn't really say it's a membership plan. She just said, well, the price differs depending on the health of your gum tissue. She's already throwing in all this crazy stuff. You won't find out until the exam. Um, then she said, if you come in, we can throw a pamphlet at you. Oh, by the way, we can't see you until June. June. It's the beginning of February right now. That's unacceptable. That's a different topic altogether. But if you cannot see a new patient for 4 months, 5 months, whatever, you are losing so many patients and so much revenue, and your practice is not growing as quickly as it should be. Again, different topic altogether, but um, no attempt to get me in, to put me on the call list, whatever. Just no chance of getting me as a patient. So not good, not good. Okay, let's keep trying. Maybe this office will do it better.
Thank you for calling Family Dental. To get you to the best team member, please select from the following menu. If you are considering becoming a new patient, please press 1. If you are an existing patient, please press 2. For all other questions for our office team, please press 3.
Love those menus.
Your call may be recorded for quality and training purposes.
Oh, I'm really worried now. Please pick up.
Good afternoon. Thank you for calling Family Dental. This is Sherry. Can I help you?
Hey, yeah, Sherry, I have a question for you. I'm pretty sure I need a lot of dental work, like 4 crowns or so. I just want to ask, what are the different financial options that you have for that?
The only thing we offer here, we do accept Care Credit, which is a third party that you would apply directly on their website and be able to utilize here. But unfortunately, that's really the only thing that we offer here in office.
Oh, okay. Got it. Well, thank you so much.
Yeah, you're very welcome. All right.
Okay.
Bye.
Bye. You got to be kidding me. First of all, she let it ring like 4 or 5 times, which is unacceptable. Okay, now I said I need 4 crowns, right? So that's, I don't know, depending on your fees, where you are, $6,000 or so worth of treatment. This is a patient who wants to come to your office and spend at least $6,000. So what does she say? Unfortunately, the only thing we offer is Care Credit. Well, why is that unfortunate? Care Credit's awesome. Care Credit will give you 6 months interest free, and the dental office has no risk. You want your patients to utilize that. So I don't know why she was apologizing and saying, unfortunately, that's the only thing we have. It's a great thing to have. So many people would love to take advantage of it. I don't know why she was turning into a negative. To me, it's a super positive. So, and then of course, no attempt at all to make the appointment. So, probably just loss of a $6,000 to $10,000 patient right there, and apologizing for offering a great financial option. I don't get it. I don't think I've ever heard a worse presentation of Care Credit. Hang on. Let's see if we can get worse.
Thank you for calling Dental Care. Press 1 to speak with a receptionist.
It's my only option. Why do you have that if it's the only option?
Dental Care, this is Corby. How can I help you?
I have a question for you. I need a bunch of dental work done, like 4 crowns and chlorves or something like that. I can't remember what they're called. So I don't have any dental insurance. Do you have any different financial options or ways that I could pay for that?
Well, it's also it would be is the Care Credit. If you applied for Care Credit, you know, that's an option.
Yeah, I don't even know what that is. Okay.
Well, it's just like a loan that you can get and you have to pay back. The interest rate is very high, though. You have like 6 months of maybe no interest, but if you're late for any payment or if you don't have it paid off in 6 months, it is a a very high interest rate that they will hit you with all of it for the 6 months. So
Wow, they'll just hit you with that high interest rate.
they'll hit you with all the months that you got for free too.
Oh,
Yeah.
man. Why would I ever want to do that option?
Well, I don't know. I'm just telling you what the other option is, but I like to tell people about it because I hate to have people get in trouble with it. You can only do it if you can manage it. So yeah. Other than that, I mean, if somebody comes in for a crown, normally when we prep it, we ask for a certain amount, and then when you get it in your mouth, we ask for the other amount. So it's just divided into a couple different months. But no, other than that, I don't think you're going to find a dentist to put it in your mouth without it being paid.
I see. How much is a crown?
You would have to come in for it. It's over $1,000.
Over $1,000. Okay, gotcha.
Yeah.
Okay, great.
All right.
Well, that was really informative. Thank you so
okay.
much.
Bye-bye.
Are you serious? That's the winner. That's the worst presentation of care credit or outside financing I've ever heard. Again, patient needs $5,000-$6,000 worth of treatment, and she's saying, well, we do offer care credit, but man, they're going to hit you with some crazy high. Could you imagine if you went into Best Buy to get the big screen TV for the big game and you pulled out the big credit card and they said, oh, you can use that credit card, but I'm just warning you, if you don't pay it off on time, they're going to hit you with a really high interest rate. I don't want to be like unsympathetic here, but that's not your problem. You're giving a patient different financial options. If they want to pay cash or check, they can. If they want to utilize outside financing, that's their issue. Why would you ever tell a patient that you've got this option, but they're going to destroy you with a ridiculously high interest rate? Come on. It's all in the agreement they sign and don't read, but you're giving them 6 months interest free. You might be able to do 12 months interest free. Don't you want patients to come in? That was unbelievable. And then at the end, she just kind of blew me off. Just when you think you've heard it all, right? That was just unfathomably horrendous. Let's try one more. I know we're going to get somebody good here. I know it. I can sense it.
This is Mackenzie. How may I help you?
I have a question for you. I'm pretty sure I need a lot of dental work, like 4 crowns or so. And I just want to know, what are the financial options you offer at your office?
Yeah. Do you have dental insurance?
I don't.
Okay, no worries. So we do accept self-pay patients. All of our self-pay patients do receive a 5% discount on all services completed in our office. Other than that, we do offer a Club Smiles membership. So with us not having established care with you quite yet, it would be hard to kind of give you an estimate on that one, just as I don't know what your dental needs are. But I can let you know that Club Smiles membership starts out at $4.95, and that would include 2 dental exams per year, as well as a limited exam here for you. And then if you were to elect for that Club Smiles, you would receive an additional 10% off of that 5, so a total of 15% off any restorative services. Other than that, we do accept care credit, so I'm not sure if you're familiar with that, but it's essentially a credit card that you can use at medical offices or even vet offices, so I'm not sure if that's something you have or not, but we would be happy. Okay. We would be happy to help you apply for that if that would be something that you're interested in.
Got it. And what's a limited exam?
So that's going to be if you have a particular concern that you need looked at.
Got it. Okay, got it. Wow, that's a lot of options. Cool. Right.
Yeah, so there's a few options. I'd be happy to get you on the schedule. It sounds like you're due for a full exam and cleaning, and if you would like to discuss with our care coordinator further details about that Club Smiles membership that I briefly explained or care credit, that you are more than welcome to do so.
Got it. All right. Well, hey, thank you so much for all that info.
Okay, yeah, no worries. Could I go ahead and grab your name and phone number to follow up with you?
Not quite ready for that yet, but I really do appreciate you asking, and I know where to find you when I'm ready.
Alrighty, not a problem. Well, you have a great rest of your day.
You too. Thank you so much. You're very kind.
Not a problem. Bye-bye now.
Okay, bye. Okay. Not bad. First of all, she was super friendly, super kind. That just showed through in her voice. I could tell she cared. She wanted to do a great job for me. She was patient, answered my questions. That was awesome. She offered me an appointment. Yay, that was awesome. And then when I kind of blew that off, she got my contact information or at least tried to get my contact information for a follow-up call. So way to go. Congrats. That was all great. I got to say, I'm not a big fan. I love membership plans, but I think she went into way too much detail, quoting fees and all that stuff about the membership plan over the phone. I think that could have been handled maybe a little better. Maybe she could have really stressed that they have a ton of different options. Let's get me in for the appointment, and their financial coordinator can review the costs and the different options with me. But all in all, I would say kind of a breath of fresh air here. Nice. Most people are nice, but nice and competent. What a combination. She tried to get me on the schedule. She tried to get my contact information. You could tell she had a big smile on her face. So we're going to end today with a winner. Way to go. That should be a good ending, right? Hey, I'm Dr. Richard Madow, co-founder of the Madow Center for Dental Practice Success. You can reach me personally at rich@madow.com, RICH@MADOW.com. That's also our website, madow.com, MADOW.com, if you want to see about some great things we can do to help your practice, including our amazing one-on-one coaching that I got to say is the absolute best coaching program in the United States. Check it out or send me an email, rich@madow.com. See you next time. Thanks.